coming up.
It's a great day, so make it everything you want it to be. It's yours and it's mine. It's a great day to shine.
Welcome back, everyone. Having a baby is a dream come true for many women, but no matter how hard we try, some of us can't lose the weight we gained during the pregnancy. Surgery may be an option, and we're asking the doctor. Dr. Lane Smith and Carolyn Westwood, a mom, joins us now with more. Good morning to you.
Good morning.
Good morning. And welcome back.
Thank you for having us back.
All right, Dr. Smith, tell us, how much weight does the average woman gain after pregnancy?
Well, the weight varies greatly. I mean, what is recommended is they should gain less than 25 to 30 pounds during pregnancy, and then after pregnancy they're left with some weight, obviously. Hopefully they can lose most of that. The problem isn't mostly the weight. It's really not the weight. It's the skin. When the baby is born, the skin, when the baby is developing, the skin stretches out. Then what happens is after the baby is born, the patient, many times the women can lose the weight. They can lose all of it, but they're left with the hanging skin. And in fact, this would be Carolyn's problem. She had lost a lot of that weight.
Why is it that we can't lose that extra skin?
Well, skin has only so much elasticity to it. It can be stretched only so far. So we find this problem in massive weight loss patients who have lap bands. They lose tons of weight. The skin elasticity has been stretched out. It pulls back as much as it can, but then it's left over. The other thing that happens is when you have a baby, you actually grow new skin. People don't understand that, and even some doctors don't understand it, but skin actually grows when things expand. So not only when we lose the weight, are we relying on the elastin fibers to pull it back, which may or may not be able to do that, but the truth is you can't ungrow something. Once something has grown there, you can't ungrow it. You can't grow shorter, you can't, certain things can't happen, and so there's no way to get rid of it other than sometimes surgery.
Okay, and Carolyn, how many kids do you have?
I have 2.
You have 2, and tell us your position here. What happened to you, and what weight did you want to, remove?
Well, after I had my children, I had that loose hanging skin, and then I gained and lost weight, and the skin sagged some more, and it never went away. It just stayed there.
And that's why you opted for the surgery?
Yes.
And you had your surgery how long ago?
7.5 months.
And how's it going now?
Fantastic. Okay,
let's take a look at her before and after here. This is incredible. Can you explain to us what we're seeing?
Well, this is Carolyn from the side view, and you can see before and after. And honestly, she'd been really good about some things. She'd gained a lot more weight. She'd lost about 25 pounds. But what was happening is, as she was losing weight, the skin was actually hanging more and more. It was actually getting worse. So in clothes, it might look a little better, but undressed, naked, it was actually looking worse. The skin will not go away just by diet and exercise. Once you've got that extra skin, actually we have to remove it. There is really no other way.
Yeah, and she looks fantastic now too. And this doesn't happen for women who are, who have given birth. This is for people who are overweight also and have tried to lose weight. They still have that little pooch left.
If you lose a lot of weight, if you gain a lot and lose a lot, you'll end up with a lot of skin left over.
And here we have a second before and after, and tell us what we're looking at.
Well, this is just a front view from Carolyn, and you can see on the left-hand side is the before, and on the right-hand side is the after picture. And you can see she's, much improved there.
And Carolyn, how are you feeling these days?
I feel wonderful. I've got my self-confidence, my self-esteem back. I really feel good about myself now.
And did you also try diet and exercise?
Oh, yes.
And tell us about that.
I would get on the Gazelle for 2.5 hours a day. I dieted. I tried several different kinds of diets, and I was able to lose weight, but not the hanging, sagging skin.
And my twin sister just gave birth too a little while ago, and she cannot get rid of that little pooch left, and everywhere else she's fine. So she's considering doing the same thing as well. But if you're going under at the same time, can you also do breast implants as well at one time?
Absolutely.
Tell us about that.
Yeah, we do that all the time. We do kind of the mommy makeover.
Yes.
Because the same things that damage the stomach damage the breasts, having a baby. So it's very common to do a little tummy tuck and then maybe breast augmentation or breast lift at the same time.
And how long does that take?
Well, the tummy tuck depends on the amount of skin, but around 2 hours for that. For the breast surgery, if it's just an augmentation, that's another 45 minutes to an hour. If it's a lift, it could be another 2.5 hours. So it could be 4 hours.
And most people opt for that since they're under.
Yeah, they like to do it all at one time. Yeah. Your mom, you said your twin sister, so your poor mom probably suffered with this.
Oh yes.
Well, because having twins, you know, it's twice as many. Twice as many, more likely her skin would be stretched out than someone who just has one child.
Exactly. All the things that women go through, it's not fair.
It's not fair at all. Only women. I always say women. Only women have hearts big enough to deal with that.
That is true. Thank you so much for both of you for joining us this morning, Carolyn and Dr. Smith. Thank you so much.
Thank you so much, Stan.
If you want more information, just head to smithsurgery.com or call the number on your screen. Sean, over to you.